All right, welcome to the deep dive, everybody. Today we're diving into something really, really important when it comes to international medical graduates, IMGs, and how they can practice medicine here in the United States.
Yeah, for sure.
We're talking about the Educational Commission for Foreign Medical Graduates, the ECFMG.
Yeah.
And I don't know about you, but I've been seeing a lot about a pretty big change they've made to how they certify these IMGs. And it all boils down to medical school accreditation.
Yeah.
Like, are these schools actually good schools?
Exactly. Like shifting gears.
Right.
Big time.
Huge change.
So think of this as us taking a deep dive into like a major gear shift in the world of medical education and how, doctors are regulated. I think what we want to do today is really try to figure out like what prompted the ECFMG to make this move towards accreditation.
Right.
Like what is it saying about how the quality of medical training is viewed globally, and what could it mean for healthcare in the U.S.?
Right here at home.
Right here at home.
Yeah.
And we've got the inside scoop. We've got a great document straight from the ECFMG outlining their 2023 medical school accreditation requirement.
Okay. Perfect.
So let's see what we can learn. Right.
Yeah, let's dig in. So to really, I think for me at least, to understand why this whole accreditation requirement is such a big deal, we need to go back in time a little bit, right?
Yeah.
Like the ECFMG wasn't always about, deeply looking into medical schools. It wasn't about that. Like, how did it even start? What was their initial focus? Like, give us some historical context.
Okay, so picture this. It's right after World War II.
Okay.
And the U.S. is seeing a ton of physicians who trained in other countries coming here wanting to practice.
Okay.
At the same time, the whole hospital system in the U.S. is growing, and that's creating more residency spots than U.S. medical schools could fill on their own.
So I'm seeing this like supply and demand issue, right?
Yeah.
Like we need doctors. We need more doctors than we can train here.
Yep.
And so these people are coming in from overseas. But like, how do we know if they're good? Did we have a system in place back then?
Well, that was the problem, right?
Oh.
The different state medical boards and hospitals and the programs that train new doctors, they were all struggling to figure out if these international physicians, these IMGs, were ready to go.
Yeah, I could see that being a nightmare, like 50 different states trying to evaluate all these different types of training, different backgrounds.
Oh, tons of different credentials, different educational systems,
Yeah.
different languages even.
Yeah. So chaos.
Chaos. So they needed a central agency.
Makes sense.
That's where the idea came from. So the Federation of State Medical Boards,
Okay.
they proposed an organization that would vet the credentials of IMGs and also administer a test, like a preliminary exam,
Okay.
even before they could apply for license in any state.
That's interesting. So like a clearinghouse, a checkpoint.
Right.
Okay.
Yeah, exactly.
So the ECFMG, it wasn't just like poof out of thin air.
No,
It was built out of a need, a
Yeah.
very specific need.
a very specific need within the U.S. healthcare system.
Okay.
And, there was a lot of support for this. The American Medical Association was on board, the American Hospital Association, even the Association of American Medical Colleges.
So all the big players
So
basically.
all the big players were like, we need this.
Okay.
And since they started in 1956, the ECFMG has certified something like 320,000 IMGs.
That's a lot. 320,000.
That's a lot.
That's a lot of doctors.
That's a lot of doctors.
That's wild. It's like a whole city of doctors,
That's crazy.
And it makes you realize like how important IMGs are to the entire medical workforce here in the U.S. Like we rely on them.
Yeah, nearly a quarter of all licensed physicians in the U.S. are IMGs.
Wow. Yeah, that's a foundational part of our healthcare system. Like they're not just like a little add-on, they're a core component.
Absolutely, yeah.
And so you were saying this ECFMG certification, it became like the golden ticket.
Yeah, the golden ticket.
For IMGs wanting to work here, get into these residency programs.
Yeah, those ACGME accredited residencies.
Okay.
And eventually get their unrestricted medical license.
Okay. So if you trained outside the U.S. and you wanted to practice here,
ECFMG.
yeah, ECFMG had to go through them.
Definitive gatekeeper.
Gatekeeper.
And initially, the focus was very much on the individual doctor.
Okay.
Their qualifications, their scores, their training, all of that.
Right. So it was very much like, okay, doctor, you're right here in front of me. Let me look at all your stuff.
Right.
Test your knowledge. Make sure you're good. But now things are changing. Now it's like, we also need to look at the school you went to.
Right.
Right.
Yeah.
So like, what's the story there? What prompted that shift to looking at the institutions themselves?
Yeah. So there are a few things that really made ECFMG reevaluate their criteria.
Okay.
They realized just checking out individual graduates wasn't always enough
Mm-hmm.
to make sure there was, a consistent level of quality.
Right.
So now they're looking at the medical school itself with this requirement for accreditation from a body that they recognize.
Okay, so they're adding another layer to the evaluation process.
Exactly.
So let's dig into the why, right? Like,
Yeah.
what were the specific things that pushed ECFMG in this direction?
Well, one big piece is just how different medical school quality is around the world,
Oh, yeah, of course.
and how the systems that are in place to oversee them, they vary so much.
Right.
Historically, ECFMG would use things like the World Health Organization's World Directory of Medical Schools,
Okay.
and later on, the World Directory of Medical Schools, which came from IMB and the Avicenna Directory.
I remember seeing those names in the document. So these are basically like global lists of all the medical schools out there, right?
Yeah, like big lists of every recognized medical school around the world,
Okay.
past and present. But, and this is important, just being on that list in the World Directory didn't mean it was a high-quality school.
Right, yeah.
It just meant the school was recognized by the government in its own country,
Got it.
and that graduates could, generally apply for medical licenses there.
So basically, government recognition was the bare minimum.
Right.
But as we were saying, that recognition could be super different from
Yeah.
country to country. Like, what does government recognition even mean?
Exactly. Yeah, in some countries, government recognition might just mean they gave the school permission to open, and that's it.
Oh, wow.
Like, very limited oversight after that.
Okay.
And even with accreditation, which a lot of countries do have,
Right.
it's all over the place, right?
Right.
Some are really rigorous and transparent, others not so much.
I see. So it's like apples and oranges.
Yeah, and in some places, accreditation is mandatory, in others, it's totally optional.
So a real mixed bag globally.
Totally a mixed bag.
Okay, so that's one piece of the puzzle, the variability in quality and how it's assessed. What was the second thing pushing for this change?
Well, think about how many new medical schools have popped up around the world.
Yeah, that's true. There are a ton.
It's exploded, right?
Yeah.
The document mentions that between 2002 and 2018, the number of medical schools worldwide went up by 48%.
48%.
48%.
That's a huge increase.
And in the Caribbean,
Yeah.
where a lot of U.S. students go to med school, it was even higher.
Really?
75% increase.
That's like a tidal wave of new schools.
Yeah.
So I guess with that kind of growth, it's got to be almost impossible to keep track of quality
Right.
just by evaluating each graduate.
Right. It just became way too much.
Yeah, that makes sense. So
And
what
it-
was the third piece of the puzzle?
Okay, so the third piece is how globalized everything has become.
Oh, yeah, of course.
Medical education and medical practice itself.
Right, everything's so interconnected now.
Right. Students go all over the place for school. Doctors move across borders for work.
Yeah, that's true. I know doctors who've trained in multiple countries.
Yeah. And then you've got medical tourism, telemedicine, all adding to this flow of people and ideas.
So it's not just doctors coming to the U.S.
No,
but
it's
global.
It's a global system.
Okay.
And this part is really interesting for you and our listeners.
Okay.
More and more U.S. citizens are getting ECFMG certified
Really?
after studying medicine abroad.
Why? Why is that?
Well, maybe it's cheaper. Maybe it's easier to get into a school overseas.
Okay.
But the point is, in 2018, the top 5 countries for ECFMG certificates include the U.S., India, Canada, Pakistan, and China.
Wow. So the U.S. is right up there.
And the number of Americans going this route has actually gone up since 1994.
That's fascinating. So this accreditation requirement, it's not just affecting foreign doctors coming here.
No.
It's also impacting Americans who study abroad and want to come back to practice.
Exactly.
Okay, so that's a big deal.
Yeah. And then the document also talks about some issues
Okay.
with medical schools doing some shady stuff,
Shady stuff. Like what?
like operating without the proper authorization or lying about their status and quality to students.
Oh, wow. So not just quality issues, but almost like ethical issues as well.
Is exactly.
Okay. So we've got this rapid growth, inconsistent quality assurance, globalization, and then like some bad actors out there.
Yeah.
So it's not surprising that ECFMG felt like they needed a better system.
Right.
Which brings us to the big change, the 2023 accreditation requirement. Can you just lay out for us exactly what that means?
Sure. So the big change is starting in 2023, if you want to even be considered for ECFMG certification, you have to be a graduate or a student who's currently enrolled of a medical school that's accredited by an agency that the World Federation for Medical Education, WFME, recognizes.
Okay, so it can't just be any accreditation.
Right.
It has to be from an agency that the WFME approves of.
Exactly.
How does that compare to the old requirements?
Well, it's definitely a step up.
Okay.
Before, like we talked about,
Yeah.
the main thing was being recognized by the government and letting graduates get licenses in their home country.
Right.
Accreditation was only needed if the country required it. This new rule sets a much higher bar.
So let's unpack this a little. What exactly does accreditation mean in this context, and what's the WFME's role?
Okay, so accreditation is basically a formal process where an authority, a recognized authority, looks at an institution and sees if it meets certain standards.
Okay, that makes sense.
And the WFME, the World Federation for Medical Education, is a global, non-governmental organization focused on improving medical education quality.
Okay.
They're the key here.
Okay.
They're the ones who recognize the agencies that accredit medical schools. They don't accredit the schools directly.
Oh, okay, so they're like accrediting the accreditors.
Yeah, exactly.
Okay, so they're kind of like setting the standards for the organizations that evaluate med schools.
Right. And their criteria for recognizing these agencies are based on guidelines from the World Health Organization, the WHO.
Okay.
So the goal is to make sure these accrediting agencies are really top-notch, but also to give some flexibility so standards can be adapted to a country's specific situation.
Right, because what works in one country might not work in another. But the big picture is to try to get some global consistency in medical education standards.
Yep, that's the goal.
Okay, so how does the WFME actually decide which accrediting agencies to recognize?
It's a pretty involved process.
Okay.
First, the agency has to do self-evaluation.
Okay.
They compare themselves to the WFME's criteria. Then, WFME sends a team of experts to do an on-site visit.
So they actually go and see how the agency works.
Yeah, they see everything firsthand.
Wow.
And it's crucial that the agency makes its standards public and has a way to regularly review and update them.
Okay, so transparency is a big deal.
Huge deal. They also need policies to ensure fairness and avoid conflicts of interest. And they have to publicly list all the schools they accredit.
So lots of checks and balances.
Lots of checks and balances. And usually, WFME recognition lasts for 10 years, with the agency having to report on their activities annually.
So it's not just like, okay, you're good forever.
No, they got to keep proving themselves.
Right, that makes sense. The document mentions some examples of WFME recognized agencies. Can you give us a few, just to get an idea of who we're talking about?
Sure. So there's the Australian Medical Council. They accredit schools in Australia, the Committee on Accreditation of Canadian Medical Schools, and the Liaison Committee on Medical Education, or LCME. They're the ones for the U.S. and Canada.
So it's a pretty diverse group geographically.
Yeah, and the document mentions that when they were writing it, agencies from places like China, Ireland, and Cyprus were all going through the WFME recognition process.
Okay.
And many others were getting ready to start. So it shows there's real global buy-in to these standards.
It seems like it's becoming the gold standard, really.
It's definitely gaining traction.
Now, this whole move towards accreditation, it seems to fit in with what a lot of organizations in the global health community are pushing for, right?
Absolutely. It aligns perfectly with the World Health Organization's global strategy on human resources for health, Workforce 2030. One of their big goals is to have national accreditation systems for health professional training in every country by 2020.
So ECFMG's new requirement is helping move the world closer to that goal.
Exactly. It's not just a U.S. thing. It's a global effort to improve standards.
Got it.
And you've got groups like the International Association of Medical Regulatory Authorities, IAMRA,
Okay.
and the World Medical Association, WMA,
Right.
both saying accreditation is vital for good medical education and patient safety.
So there's broad agreement that this is the way to go.
Yeah, a lot of consensus there.
But, what's the evidence that accreditation actually leads to better outcomes?
That's a great question. Like, does it actually make a difference?
Yeah. Does it actually translate into better doctors?
Well, research on medical school accreditation is still kind of new, but there are studies showing a link between accreditation and good outcomes.
Okay.
Like, some studies have compared students from accredited and non-accredited schools on exams, like the USMLE
Right.
and national residency exams.
Mm-hmm.
And generally, students from accredited schools do better.
That's a good sign, right?
It's encouraging.
It means it's not just a system on paper, it's actually translating into better preparedness.
Right.
Okay, so what else does the research say?
Well, there's also some qualitative research suggesting that going through the accreditation process makes medical schools more focused on their mission.
Mm-hmm.
They develop better internal structure and oversight, and they improve their curriculum development and data collection processes.
So it's not just about teaching the right stuff, it's also about having the right systems in place.
Exactly. And even though accreditation can be costly and create extra work for schools,
Yeah.
most schools say it creates a culture of continuous improvement.
So like a long-term investment in quality.
Exactly.
That makes sense. Now, ECFMG didn't just spring this new requirement on everyone all at once.
No, they didn't.
They had a whole plan for rolling it out. Can you walk us through that?
Sure. So, knowing this was a big change, they did it in 4 phases. To be transparent and give everyone time to adjust, Phase 1 started back in 2018,
Okay.
and it was all about giving future med students more info to make better choices.
Okay.
They created a new online resource highlighting key things to look for in quality medical education and what questions students should be asking.
That's a really good idea to give people the tools to make informed decisions.
Right, empowering students.
Right.
So what happened in the next phases?
Yeah. What came next?
Okay, Phase 2 rolled out in 2020. And that's when they started including info about a school's accreditation status right in the World Directory of Medical Schools.
Okay.
So if a school was accredited by a WFME-recognized agency, it was right there in their listing.
So making it clear in public.
Exactly. More transparency for everyone involved.
I like it. What about Phase 3?
Phase 3 started in 2021, and that's when ECFMG began adding accreditation details into the reports they send to residency programs, employers, and licensing authorities.
So even more transparency throughout the whole process.
Yep. So when an IMG is applying, everyone knows the accreditation status of their school.
Okay, so it's not just on the student to provide that information.
Right. ECFMG is making sure it's front and center.
Okay, and then Phase 4 is the full implementation of the accreditation requirement in 2023.
Right. So all applicants for ECFMG certification must be graduates of a school with that WFME recognized accreditation.
Got it. So a very deliberate and phased approach to making this big change.
Yep. And it was all about increasing transparency at every step.
Makes sense.
So, yeah.
So what did ECFMG think would happen as a result of this new requirement, and what are we seeing so far?
They figured this would push for higher standards globally and encourage more schools to get accredited, even in countries where it's not mandatory.
Okay.
They also thought accrediting agencies would want to line up with WFME's criteria to get that recognition.
So kind of like a ripple effect of positive change?
Exactly. And it seems to be working.
Really?
Yeah. Lots of accrediting agencies worldwide have either gone through the WFME recognition process or are in the middle of it.
That's great.
And even agencies in countries where grads don't usually apply for ECFMG certification are doing it.
Oh, wow. So they see the value in it even if their grads aren't necessarily coming to the U.S.
Right. They want to show they're committed to quality and have international credibility.
That's really impressive.
And we're also seeing more schools working towards getting accredited by these recognized agencies.
So it's like a rising tide lifting all boats.
That's a good way to put it.
Everyone's stepping up their game.
Yeah, and ultimately the goal is more transparency and continuous quality improvement in medical education around the world.
Which leads to more competent and safe doctors everywhere.
Exactly. And that builds trust in the medical profession.
Right, because at the end of the day, that's what it's all about.
Absolutely.
So this whole deep dive into ECFMG's 2023 accreditation requirement, it shows how the U.S. is changing how it looks at IMGs.
Mm-hmm.
It's not just about the individual doctor anymore, it's about the school they went to and making sure it meets these globally recognized standards.
Yeah, it's a big shift for sure.
Driven by all the changes we talked about in global medical education and practice, and the hope is that it will make a real difference in quality and consistency worldwide.
It's a complex issue, but you summed it up really well.
Thanks. And, it makes you think, what will the long-term impact be on international medical education and the global healthcare workforce?
Yeah.
How will this affect not just IMGs, but also how we view medical education in different parts of the world?
Yeah.
And what other questions does this raise about ensuring quality in a field that's becoming more and more interconnected?
It's definitely a lot to think about.
Yeah, a lot to think about. Thanks for joining us for this deep dive. It's been a fascinating conversation.
My pleasure.
And for all of you listening, keep those questions coming. We'll see you next time on The Deep Dive.